Hi, everyone. Welcome back to the podcast. Welcome all new listeners and welcome back to those who heard my content in the past. If you want to know two types of athletes and how to treat them differently, you have to tune into this episode. This episode. Before I go on to the podcast, what is new with life? What is new with my kids, my family, everything, all the above. Life is fantastic. I have my strength and conditioning summit coming up in the next 2 or 3 weeks. So I'm really excited about that. Been prepping for that. Been training more consistently. Those who know, I enjoy CrossFit. So I have the Murph workout coming up in a couple weeks, or in a week actually, and have been prepping for that. I'm still struggling with that calf strain. It is like 90%. I'm doing everything I can in the background, so wish me luck. My kids are doing fantastic. My son, Zach, just got an award for being creative and innovative. And then he just recently got chosen to be, I guess, one of their speakers at one of their ceremonies. So I'm proud of him. He's doing exceptionally well. So my daughter's doing fantastic. She's loving ballet, closing that out soon. And Jacob is Jacob. He has a personality and he is telling me what to do already. My wife is fantastic, and we just went on a date night. Those who don't do that, it's a big deal for me. I love my date night with my wife. It's a time to refresh. It's a time to just kind of. I feel like I'm dating my wife again, and it's such a great feeling. Opening doors, making reservations, just that whole experience. So if you're not doing it, you need to be doing that more often. So that's a promise within ourselves to just make sure that we're happy. So yeah, that's what's happening. All right, on to this podcast. What are we talking about? Why two different types of athletes? This was a fantastic conversation I had with a physical therapist about I think the initial conversation was it's funny how conversations go different directions based on the question. Uh, how do I get athletes to stay motivated? And the question becomes, when you're in post-op or you're working with somebody, long term, how do you keep them motivated? And truth be told, this can be applied to like your personal relationship, your athletes. If you're a direct report for other people and other people you mentor, I use it for my staff. I use it for the physical therapist. I use it for clients. I use it for you name it. Um, and off of that conversation, I went back to something I've read in the past, and I want to share it with you guys because you're going to find yourself stuck. You might say like, "Whoa, I'm fantastic this week. I got 20 patients better, and these five just don't seem to be getting better." And now it can be the complexity of their injury, or it's the way you're managing them. And I'm going to talk about the latter on how you manage and progress people throughout their progressions and into their rehab progressions or whatever it is. And while you might be focusing on the exercise progression itself and the volume and the parameters and sets and reps and all the above and the range of motion, the MMT, there's another layer right behind that that I want you to be aware of. And that's why I call this one two types of athletes. There really are two types, and it's two types of patients, two types of athletes. And it's based off of a book I read in the past. I'll get you guys information later. But it's on this concept of locus of control. And let's take two athletes with the same injury. Let's do an ACL reconstruction. Okay. Post-op day 2, post-op day 4, they come to see you. And athlete A has one mindset and athlete B has a different mindset. So athlete A, let's call this one Mike. Mike. Mike says, I'm really motivated to get back to playing football this fall. I'm 9 months away from playing football, and I'm going to do everything in my control to get there. I need you, physical therapist, to help me get there. I want to play football this fall. Can you do that for me? Physical therapist says, I can do that in my sleep. We can hands down do this. It's very possible. There's a lot of things that are going to need to be done, and this is how we're going to do it. Athlete B Let's call him Steven. Steven says, um, I can't believe this happened to me. I don't know why it's happened to me. My career is over. I don't know what to do next. Physical therapist says, don't worry, Steve. We're going to get you back. You can totally do it in 9 months. And Steve says, I'm not sure. Like, I feel like it's my fault. What should I have done differently? Why did this happen to me? And there's two different humans there, two different ways to approach the same rehab case. Both are post-op day 4. Both have 9 months to get back to sport, but they're two different athletes, two different mindsets, and two different ways to treat them. Now, we can go through all the nuances of how to progress them, but I'm gonna give you some foundational background on how to manage these two different athletes and why it's important. Internally, you're like, okay, so what's the difference between the two? There's an internal locus of control and an external locus of control. The internal locus of control says, I am the I can own my destiny. I can figure this out. I know I can accomplish this. They have self-belief, self-confidence. They know that they're going to achieve it. They just need help and support from an external source, which is you. And then you have Steve, athlete B, who has an external locus of control, meaning they blame the external environment. It's hard for them to perceive that they have control. So the external source of everything they have, everything that's going on to them, they blame it on them. It's not, they don't have that internal self-drive. It's the external factors that they pay attention to and influences their confidence, their belief in what they can accomplish. Both can accomplish this, but the way you as a physical therapist are going to manage these rehab cases are very, very different. Yes, the exercise progressions and everything might look identical. On paper, they look fantastic. They look the exact same. But one is going to require an extra button, an extra level of support. And they're both going to be controlled just a little differently. So let's go through this. And now some of you are probably shaking your head. You're like, man, I definitely have a lot of athlete Bs and Steve, who have external locus of control. Now, you can self-identify with this. If you're listening to this podcast, you're probably having an internal locus of control. You're like, I can do this. You've been able to do it in your career. You've been able to do it in life. You're successful for a reason. And then there's people you know personally, or that you might be listening to this and maybe you feel like you have an external locus control. Awareness is the biggest key. That's all you can do. Awareness is the key factor in helping people who have these challenges or this view, because you know you can get this knee to a certain point. You know that. But what will limit their progress, and if you haven't heard my podcast in the past, where I've talked about the psychological influence of the impact on their results, it's tremendous. You can have athletes who have the same injury, the same timeline, but the people who have a positive thought process or positive influence, that they are going to achieve that. So if they say, I'm 90% better, I'm 100% better, but they don't have the metrics to show that they're quad atrophy, they have all this other stuff, versus you have somebody who has 100% jump testing, 100% MMT, girth measurements, everything else, but their self-confidence is 60, 70%. The highest risk of injury is the self-confidence, not just the domains of measurements and impairments. So that self-confidence is huge. So somebody who feels prepared is going to do better than somebody who doesn't feel prepared, even though their objective measures are vastly different. So when you're talking about internal versus external locus of control, that's what it's really coming down to. How will their outcomes differ? And ultimately, let's talk about athlete A, Mike. Mike is going to do well. They're probably going to push a little bit more than you want. But Mike requires criterion based progressions. So, for instance, uh, you can't call for him. You can't say time based. Okay, at 4 weeks you're going to do this. 8 weeks you're going to do this. 12 weeks you're going to do this. Why? Because with Mike, if you go based on time, he's so motivated that he doesn't even care about what his impairments or measurements are. Once he hits the time point, he's going to say, you gave me a green light, I'm ready to go. He's going to need more criterion based, meaning he needs, I need you with, you need to be at 90% of girth measurements. You need to be able to do 20 single leg step downs. You need to be able to do balance with eyes closed for greater than 30 seconds on the involved leg. You need to be able to ascend and descend stairs reciprocally. Like you're giving them criteria to move on to the next phase. So people with an internal locus of control, they need criterion-based progressions. They need to achieve certain markers, not time, because time will be irrelevant because they're internally motivated. And you have to be aware of that. Now, we might say, all right, Steve, athlete B, who has an external locus control, they're blaming the world. This is so hard. I don't know why it happened to me. You can't get them motivated. On these individuals, you might have to blend that and say, listen, here's the time-based progression of where I need to see your improvements. They won't be internally driven, so criteria will help, but they need to see the map. They need to see the long journey in order for them to be successful. Mike, on the other hand, you're trying to put him at stoplights. Like, no, hold on. You're going too fast, Mike. So Mike, athlete A, internal locus of control, criterion-based progressions. Athlete B, these individuals, you need to show them so that they can at least hit certain markers along the way. They need to see time-based progressions. They need to see a little bit of criterion-based. But ultimately, you know what they need a lot of? They need a lot of your support. They're going to need you constantly reevaluating them, constantly knowing that they're in the right path, constantly reminding them that like this is not their fault, that this is in their self-control. It's a longer process. It's a different relationship that you have. This one, you feel like a superstar. Mike, you feel like a superstar physical therapist. Steve, you feel like, oh my goodness, these are big sessions. And they're both rewarding when they get out. They're both going to get back to sport. But the amount of energy and support that you're in need are going to be vastly different. And I think you need to understand that after working in professional sports for, near a decade and working with pro athletes, probably my entire career now, I could tell you the way you can split and understand people, it's not by their injuries, it's not by their impairments. It's by who they are, what they process, what their internal motivation is, what their personality is. And that is something that you can't master in a year. Yes, you need reps, but the clinician who can identify, awareness is key, right? You cannot make progress without awareness. Most physical therapists base their progress on outcomes based on measurements. But what I can tell you is, honestly, you can have a dramatic impact on people if you can identify the personality, internal versus external locus of control, who happens to have a knee, shoulder, elbow injury. Because what you're doing is you're managing the human and treating the impairment. Most people try and manage and treat the knee and hoping that that fixes it. But if you have somebody who has external locus of control and they feel like the world is upon them and it's going to be so hard to get out of here, and you treat them the same way as an internal locus, where you're like, hey, here's all the criteria, that person can't see it. It's not good. It's too far for them. Like it's not even achievable. You're going to do them a disservice. Why? Because you're not identifying and managing that treatment process the same way. And ultimately, the person who has an external locus control needs a lot more short-term time markers. They can't see it so far. With Mike, athlete A, internal locus, you might say, it's okay. By week 6, I need this. By week 13, here's what your measurements need to be. Here's why week 18. Steve, external locus of control, is going to require shorter markers. Every 2 weeks, we're going to reevaluate. Here's what I want from you at week 2. Here's what I want you at week 4 and week 6, because they can't see the destination. Their vision is so short-sighted. Their motivation is less. Their challenge is going to be more. And how you manage these two individuals will determine how good of a physical therapist you are. Now, your ability to correct impairments is fantastic. Your ability to make adjustments and correct impairments based on a person's personality, history, locus control, involvement, how motivated they are, that's an art. And that's really what's going to separate most physical therapists as a true sports physical therapist or an ortho physical therapist who happens to have an interest in sports PT. And your ability to identify these people will be the start of it. So here's a couple things that I want you to focus on. Here's the dangers, and here's how I don't want you to go through. I don't want you to go through and assume every knee is the same knee. So how do you identify what their locus of control is? You have to ask a couple big questions, and ultimately, the initial evaluation will tell you everything. And you need to gauge and get an understanding of who they are. And it might take you a couple visits. I get that. But if you have some intuition, intuition is the difference between successful individuals and not. Now, some form of intuition has gotten you to a certain point where you are professionally. And that intuition has brought you success because you've been able to not predict, but you've been able to understand certain circumstances. And so when you have a patient, an athlete right in front of you, and you're kind of gauging them on what their motivation is and how they got to a certain point where they are today, that intuition is probably right. So you'd be able to tell right from the get-go, and you can make adjustments from the beginning, from the outside. So, first one, how did this happen to you? Okay, great. What's your goal to be able to get out of this? Okay. If you can rate your motivation to achieve this goal, 0 to 10, 10 being the highest, what would you rate that? Fourth, what previous injuries have you had and what happened? What you're going to do is you're going to get them to tell stories. You're going to get I was hurt in high school. I was hurt in college. I was hurt when I was 10, right? You're going to get all these stories. And then you're going to get a sense of were they externally caused or internally caused, and are they blaming other people for their injuries, or they're like, yeah, I got hurt, but that's not a big deal. That's not what I'm talking about today. That person can separate those two. Somebody with an external locus control blaming all the world on them is like, oh, yeah, I've been struggling with this and ever since high school and all these other things. And I've been, this has led up to this. And that person, you already know what they're doing is they're using past experiences that still influence today. Somebody who has an internal locus control is like, that's irrelevant. I'm talking about my knee. Can we talk about this? I'm ready to move on. I'm motivated. They're a whole different human. And the way you can figure that out, ask those 4 questions just to start. Get them to talk. Get them to answer all the questions. Tell them the story. Tell them. And then what that'll do is help you figure out, all right, which way am I going with you? Do you need short-term goals or do you need criterion-based goals? And that helps you figure out how you're going to set up your rehab program and your progressions. So if you're going to go out 6, 9 months, 12 months, whatever it is, somebody with external locus control, you're not going to go out that far. You need to give them shorter markers and then update them along the way. In internal locus control, you can go further out, 3, 6, 9, 12 months, and base them off a criterion. Both require different types of homework. So when you're programming for people, most physical therapists don't encounter this or work in this type of fashion. Why? Because they're only seeing people for 6 to 8 weeks. That's where most physical therapists specialize, unless they're post-op. Then you probably see them 3 or 4 months. Where this really comes to about is when you start programming for individuals. You know who really specializes in this is uh, strength and conditioning coaches. They are obsessed with finding out the motivation of an athlete. Why? Because they need to be able to manage them for a year minimum. So if you're in a college setting, in a high school setting, you probably get them in the fall or the summer, and you're going to get them all the way to the end of the following year. And you need to figure out who's your internal drivers who are going to stay motivated that you don't really have to, you know, once you give them a program, they're going to stick to it. And then you have the others who are blaming the world. They have a hard time. They don't have that internal self-drive. They need the external source to keep them on track. And that's where a strength and conditioning coach really comes in. They're like, hey, listen, this is the program. I'm going to support you. You need to watch their form. They need external cues, these all of those things. The internal drive is probably going to be your leaders, your captains, those type of people, or your quiet individual in the back who's willing to put in the time and energy, doesn't really need a lot of support. And when a strength coach has 20 to 60 people, that's what they're doing. They're trying to figure out who needs my support and who doesn't. Now, once you can master that at scale, that helps you identify where you're putting energy, when to push and pull, because during workouts, during training sessions, during team meetings, you're trying to figure out who needs this push and pull. And as a physical therapist, you're seeing a person one-on-one for 6 to 8 weeks, up to 3 to 4 months. Now, when you work on one-on-one, that's not that hard. You can help identify that. But think about this. For some of you, you see one patient an hour. For some of you, you see 4 patients an hour. It's hard to push and pull when you have a lot of volume. So the best thing you can do from a time and energy standpoint, not everybody needs like, let's go, let's go, let's go. But not everybody needs, here's your program, go get it. You need to figure out how to push and pull, just like a strength coach does. You're doing it across a week for 6 to 8 weeks. They're doing it for daily and weekly progressions up to a year. And after working with strength coaches in professional sports, that's really where I took this concept from. Like, how do you keep people engaged? How do you keep people motivated? And the whole thing that brought up this question or this topic was, how do you keep athletes motivated? And I can honestly say I've taken a lot from strength and conditioning coaches because they have mastered it. They have figured out how to do it at scale on a daily and weekly basis. And the biggest thing that they taught me was, how do you figure out who the athlete is first? And that's how you keep them motivated. So it's not something like, well, you cheer them on, you give them inspirational quotes, you show them the rehab program every day, you put good music on. That's not how to keep people motivated. How you keep people motivated is based on what motivates them. That's the key. And if you can figure out what motivates people, then you target that. Well, there's two ways to motivate people, internally or externally. And if you're not doing that now, you need to. How do you improve your outcomes? How do you keep people engaged, motivated with your program? Figure out what motivates them, internal versus external. Start with those 4 questions. Base your program off of it. Ultimately, if you're looking to not just work with somebody for 6 to 8 weeks, you're wanting to push them out to 3 to 4. You want to build strength programs for them. There's no way you will help them from a wellness standpoint, beyond their plan of care, get them back to sport, if you're not implementing this, because what works for you now for 6 to 8 weeks will not work for you for getting somebody back to sport on a strength program, on a wellness program, anything beyond what you're currently doing. Why? Because you're not managing the person, you're currently just managing the knee and the impairment. If you want to take somebody out beyond that to 3, 6, 12 months, you have to learn how to manage the person across time, because right now, if you try and lose weight, you try and gain weight, you try and get on an exercise program, you know for a fact you're not going to stay motivated. That's why you need somebody else to help you with that. But now, do you need somebody cheering you on every day? Or do you need 6-week, 8-week, 3-month check-ins? And if you need 3, 6, 9, 12-week check-ins, you're probably internally motivated. But if you need support on a regular basis, weekly, keep me accountable. I need it. I need it. I need it. You're externally driven. And that's the difference. So when you start to just think about the big question that people are coming to me with, how do I design wellness programs? How do I get into strength conditioning programs at my job? I want to start working with higher level athletes. I want to start creating programs for people. How do I do that? Most people want to get like, well, how many reps should I get? How many sets? But believe me, if you can't figure out internal versus external locus of control, it'll be hard for you to build and support that program, no matter how perfect your program is, because you still have to be able to identify with people. So the next time you ask about which program should I do, how many reps, what's the exercise, I'm going to ask you how you keep people motivated, because they're going to bail out in the first, second week, even if you offer the 6-week program, a 12-week program. It's not going to be sustainable, and your outcomes will be limited. So that's really what it comes down to. So there you have it. Two types of athletes, internal versus external locus control, how to keep them motivated and how to treat them differently. One requires a lot of support, frequent check-ins. The other person needs criteria to know what their next marker is. And that's a huge way to move pieces and work with your patients or athletes at a larger scale. It'll improve your job satisfaction, and you'll be able to get more outcomes. You'll be able to treat people for longer. You'll be able to get them stronger, bigger, better, faster, not just out of pain. Out of pain is the easiest thing in our profession. I think it's like we can do that in our sleep. Question is, how do we keep them healthy and not coming back with the same injury again, or independent and being able to manage themselves? And if you can't get to that next point until you learn how to, like, what drives them. And so that's really what I want to get across for you. This should help in your daily practice, your weekly practice. But here's a challenge: where you will struggle is staying on top of these concepts and staying consistent with it. Most people will think about this, they'll try it for one person and move on. What I want you to do, wherever your list is, your priority list, just figure it out, wherever your weekly to-do list, whatever it is. I want you to put on there, determine internal versus external motivation of 5 patients every week for the next month. You can do that for me. This will build a habit. You just need more than 2 weeks to figure this out, honestly, but you just got to do it more than 2 weeks. So figure out for 5 patients over the next month, every single week. So you have 20 patients. Send me an email when it comes through, drchris@drchrisgarcia.com. Let me know. I'll give you a shout out. I'll look at your stuff. I'll help you with it. Just send me an email. I'm willing to help. I just need to know that you're doing it consistently. Okay, so there you have it. I'm excited to be able to help you on your journey. Keep you doing that. For those of you who've been asking, yes, we do have the summit coming up. If you want to just do virtual, that's totally fine. The big thing for me is I want to make sure to quality control. If you are going to sign up, please do it in the near future. I need to know how many total people, so I can help have some support team members and staff on the back end to be able to support this many people. And making sure that everybody can demonstrate plyos and everything else online, and I can see where everybody's progressions are. So please do sign up quickly, so that way I can accommodate and figure out from staffing perspective how many people I need. But other than that, I hope life is fantastic and you're doing exceptional and living your best life. Okay, I will see you guys on the next episode. Take care.